Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Respiratory medications. A Cromolyn sodium, Intal, inhaler is prescribed to a client with asthma. A nurse provides instructions regarding the side effects of this medication. The nurse tells the client that which undesirable effect is associated with this medication. Option A. Wheezing. Option B. Insomnia. Option C. Hypotension. Option D. Constipation. Right answer is Option A. Wheezing. Cromolyn sodium, Intal, is used to prevent asthma attacks in people with bronchial asthma. Undesirable side effects associated with the use of inhaler is wheezing, cough, nasal congestion, bronchospasm and throat irritation. Options B, C, and D are not related to the medication. A client is prescribed with Guaifenesin, Mucinex. The nurse determines that the client understands the proper administration of this medication if the client states that he or she will. Option A. Drink extra fluids while taking this medication. Option B. Take the medication with meals only. Option C. Take an additional dose once fever and cough persist. Option D. Limit oral fluid intake. Right answer is Option A. Drink extra fluids while taking this medication. Guaifenesin is an expectorant. Drink extra fluids to help loosen the congestion and lubricate the throat while taking this medication. Option B. The medication does not have to be taken with meals. Option C. Additional doses should not be taken without the prescription of the doctor. Option D. Fluids are needed to loosen the secretions. A nurse is about to administer Albuterol, Ventolin HFA, 2 puff and Budesonide, Pulmicort Turbohaler, 2 puff by metered dose inhaler. The nurse plans to administer by Option A. Alternating with a single puff each, starting with Albuterol. Option B. Alternating with a single puff each, starting with Budesonide. Option C. Budesonide inhaler first then the Albuterol. Option D. Albuterol inhaler first then the Budesonide. Right answer is Option D. Albuterol inhaler first then the Budesonide. If two different inhaled medications are prescribed and one of the medications contains a corticosteroid, administer the bronchodilator, Albuterol, first and the corticosteroid, Budesonide second. This will allow for the widening of the air passages by the bronchodilator, making the corticosteroids more effective. A nurse is about to administer Naloxone hydrochloride, Narcan, to a client with known opioid overdose. Which of the following equipment should be readily available at the bedside? Option A. Suction machine. Option B. Resuscitative equipment. Option C. Nasogastric tube. Option D. Dressing tray. Right answer is Option B. Resuscitative equipment. While administering Narcan, resuscitation equipment, oxygen, mechanical ventilator should be readily available. Options A, C, and D are not used during the medication therapy. A client is receiving theophylline intravenously. After several dosages, the client started to become restless and complains of palpitations. The nurse determines that the client is experiencing theophylline toxicity in which of the following? Option A. Theophylline level of 10 micrograms/ml. Option B. Theophylline level of 15 micrograms/ml. Option C. Theophylline level of 20 micrograms/ml. Option D. Theophylline level of 25 micrograms/ml. Right answer is Option D. Theophylline level of 25 micrograms/ml. Theophylline toxicity is likely to occur when the serum level is higher than 20 micrograms/ml. Early signs of toxicity include restlessness, nervousness, tachycardia, tremors and palpitations. A client with a chronic obstructive pulmonary disease is prescribed with ipratropium, Combivent. Upon reviewing the medical history of the patient, the nurse questions the prescription if which of the following is noted. Option A. History of smoking. Option B. History of allergy to egg. Option C. History of allergy to peanut. Option D. History of a previous infection. Right answer is Option C. History of allergy to peanut. The client with a peanut allergy should not take ipratropium because the product contains soy lecithin, which is in the same plant family as peanuts. Montelukast, singular, is prescribed to a client with asthma. During the medication therapy, which of the following laboratories should be monitored? Option A. Complete blood count, CBC. Option B. Sodium and potassium. Option C. Calcium and platelet count. Option D. ALT and AST. Right answer is Option D. ALT and AST. Montelukast, singular, is a leukotriene receptor and is used with caution in clients with impaired renal function. Alanine aminotransferase, ALT, and aspartate aminotransferase, AST, should be monitored while taking this medication. Options A, B, and C are not related to the use of this medication. The nurse is giving medication teachings to a client receiving theophylline. The nurse instructs the client to limit the intake of which of the following? Option A. Apple and banana. Option B. Yogurt and cheese. Option C. Tuna and oysters. Option D. Cola and chocolate. Right answer is Option D. Cola and chocolate. Theophylline is a methylxanthine bronchodilator. The nurse instructs the client to limit the intake of xanthine-containing foods such as chocolate, cola, and coffee. A nurse is giving teachings to a client receiving desloratadine, Clarinex. Which of the following statements made by the client will need further instructions? Option A. I can eat gum after I drink the medicine. Option B. I can take the medicine on an empty stomach. Option C. I should avoid using alcohol. Option D. I will avoid driving while using this medication. Right answer is Option B. I can take the medicine on an empty stomach. This medicine should be taken with food or milk to minimize gastrointestinal upset. Option A. Use gum or hard candy to minimize dry mouth. Option C and D. The medication causes drowsiness, so avoid taking alcohol or engaging in activities which require mental alertness such as driving a car. A pediatric client with asthma has just received omalizumab, Xolair. The nurse determines that the client might be suffering a life-threatening effect in which of the following? Option A. Headache and dizziness. Option B. Nausea and vomiting. Option C. Swelling of the tongue. Option D. Joint pain. Right answer is Option C. Swelling of the tongue. Omalizumab, Xolair. Xolair is an anti-inflammatory that is used to treat moderate to severe asthma that is caused by allergies. An anaphylactic reaction may happen such as flushing, rash, wheezing or swelling of the face, lips or tongue. Options A, B, and D are some of the side effects but will not alert the nurse for an anaphylactic reaction. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.